and I'll hand the call to Mr David Limbrick MLC.
Thank you.
Thank you, Chair, and thank you, Minister, for your presentation. I'd like to just reiterate and clarify something that you've mentioned a number of times, the objective of the home learning. Now, I think you stated in your presentation that the schools were never unsafe, and that the objective of having children learn from home is to prevent activity within the community and not to protect the children themselves. Is that correct in that statement?
Yeah, the public health advice and the reasoning, Mr Limbrick, has always been about limiting the movement of people in the community at schools, early childhood settings, TAFEs, universities. They remain safe places, but the overarching advice and the reason behind the advice, the Stage 3 restrictions in regional Victoria, Stage 4 in Metro Melbourne, has always been about reducing the movement. And when you think about schools, we're talking over 1 million students, their parents and students' parents and carers. Limiting the movement has been the reason why we've introduced remote and flexible learning in our school system.
Understood. Yeah. So I think we're on the same page with our understanding there. But it brings us to a very deep moral and philosophical question here, doesn't it? That what we are doing, or what the government has chosen to do in this situation, children are in the situation where they haven't seen their friends for months. They're having one of the important things about schools is learning social skills. Those social skills are being interrupted. Many students are struggling with their learning. We have, I've heard of many cases of self-harm, and maybe you can elaborate on that a bit more. It used to be that we limited children's screen time, and now all time is screen time. I've got children of my own. I've seen 7-year-olds attend an online birthday party, a Zoom meeting. Normally birthday parties are a happy event. At this birthday party, I saw half of the children, this is 7-year-olds, burst into tears and say that they didn't want to ever go to one of these things again. I mean, the government has made a moral calculation here to sacrifice the well-being of our children in order to prevent, the spread of this pandemic. I want to know, what are the calculations of the long-term harms that the government has taken to justify this? And at what point will you challenge the CHO and say maybe the harms of what you're doing outweigh the good?
Thanks, Mr Limbrick. There's a number of things that you raised in your question, and these are important matters. I'm a father of 3 school-aged children, and I see it in my own kids. There are good days and bad days. There are days where my kids are missing their friends desperately. We made an announcement last year, implemented day 1, term 1 this year, of banning mobile phone use during school time. I understand absolutely the challenge around trying to limit screen time, and then during this period of remote learning, obviously via technology, screen time is the way that kids are engaging with their teachers, with their schools, and with their classmates. I understand absolutely the impact that this is having, both good and bad. There are kids who may have high anxiety at school, who are thriving, for example, under remote and flexible learning, and there are students that are struggling deeply with their mental health and well-being. But I just want to pick you up on a point that you made. These are not decisions that the government has made in isolation. These are decisions that we have made based on expert health advice, both from the Victorian Chief Health Officer and through the AHPPC at a national cabinet level. Every decision that I've made, every implementation that we've made at a school level have been made based on expert health advice. And
have you challenged any of that advice?
Well, Mr. Limbrick, it's not a case of challenging the advice. Both at the Crisis Council of Cabinet, with my ministerial colleagues at a state level, the Premier at the National Cabinet, with First Ministers and the Prime Minister. It's about looking at all of the data, reflecting on the expert health advice, and then making decisions. And these are hard decisions, and I understand that for some students, both academically and in terms of their well-being, there will be immense work that is happening right now in Term 4 when we return to face-to-face teaching, and next year, to get these kids back on track. There's a mountain of work to do, but we're talking about the biggest health crisis that we have faced in 100 years. And we've got to make these sacrifices, and I understand the impact that this is having.
Well, you know, you talk about, you know, we have to make these sacrifices. It's possible that you're creating a generation of children with psychological damage. I mean, it's outrageous what the government is doing here. I mean, where is the calculation of the long-term harms that you believe will be happening to the children, and where is the justification of that? You say you've got this expert advice. Show us the data. Like, where's the long-term harms that you've calculated that you think are worth it here? I mean, I've been asking about these harms ever since this inquiry has started. I haven't seen anything except obviously there's recognition that there's some harm because you're throwing all this money at mental health and children to catch up with things. Where is the evidence here?
Where is the evidence that we need to provide that support so students can catch up?
Where is the evidence that the benefits that you're getting from causing these harms outweigh the harms themselves? I mean, there's methods that people have, that experts have, to calculate these harms. You can calculate in quality adjusted life years and all this other stuff. We've heard this from other witnesses. Like, where are these calculations that you've done to say, okay, we know that we're causing these harms to our children, but, you know, it's worth it because of X, Y, and Z. There's no justification that's been presented to the public.
Well, the justification and the reasoning, Mr. Limbrick, is to deal with the pandemic before us. I mean, what is the alternative? Do we pick and choose the expert health advice? I think that would be extraordinary. If I, as Minister, said to the CHO, I agree with that bit of advice and I'll take that on board and implement that, but I won't agree with this expert health advice. Or what's the alternative, Mr. Limbrick? That we have a health experiment in our nation, and we have herd immunity.
We're having a health experiment right now, and we're experimenting on the children. Like, I mean, we've never done this before. You've said this. We've never done this before. Like, there are serious harms here, and I don't feel like the government really has a good handle on the harm that it's causing. And I'm not convinced, and many people aren't convinced, that the harm that you're causing isn't worse than other actions that the government could be taken to address this pandemic and the response to the pandemic.
It's just something that we're going to have to disagree on, Mr. Limbrick. You know, the expert health advice is that to combat this pandemic, to reduce community transmission, to get those positive cases down, you need to have a system of restrictions, restrictions of movement, face coverings, ensuring businesses have COVID-safe plans, ensuring that at schools and early childhood settings, for those kids that are learning on site, vulnerable children of permitted workers, that there's risk mitigation and safety measures ensured that are taking place at a school level. I mean, these are the things that we need to do as a community to get these cases down, so we can start to progressively reduce the restrictions in place. You know, we don't have the luxury. We don't have the luxury of just ignoring the pandemic and ignoring the advice from public health experts.
I'm not saying that we should ignore
the pandemic. No, but you are
There's
saying that.
Responses. I mean, like, all right, let's look at the most serious harm here, like self-harm. Like, have you got any information on children self-harming during this lockdown period? Like, what's the numbers on this?
In terms of mental health, so we're seeing Term 2 data on referrals. So we're seeing a number of evidence and data, Mr. Limbrick, in terms of the impact on students' mental health and wellbeing, and I'll give you a couple of examples. We're seeing Term 2 data on referrals for the Headspace counselling, which indicates an average of over 1,000 appointments per month.
And how does that compare to prior periods? Non-pandemic periods?
Mr. Limbrick, could you allow the Deputy Premier to answer the question, please?
Well, we need a comparison, otherwise the data's no good.
Well, you haven't allowed him to finish answering the question to establish that.
I'll give you a few examples of data data points that we're receiving, Mr. Limbrick. So in terms of those, in terms of Headspace counselling, appointment numbers were slightly lower than this same time last year, but service uptake increased from April to June due to increasing uptake of telehealth delivery modes. So the ability for students to engage virtually, if you like. Mental health experts are warning of a surge in the need of mental health care due to COVID-19. Demand across...
Due to the government's response to COVID-19.
If I can continue, demand across Kids Helpline services in Victoria increased 8% in July from the previous month, compared with a 2% national increase over the same period. Lifeline has reported a 22% increase in calls in Victoria in July. And over the month of July, approximately 64% of calls and web chats to the Beyond Blue coronavirus mental health wellbeing support came from people in Victoria. So that's exactly why we made the recent decision of investing a further $28.5 million over the next 2 years that will increase workforce capacity. So we'll train a further 1,500 staff in mental health and wellbeing, expanding existing services and introducing new support to respond to increased students' mental health issues and disengagement from education. I'm
sorry to cut you off there, Deputy Premier, but the member's time has expired.